Hello. As I mentioned to you last week, I wanted to turn this week's video over to public health to provide you with an update about COVID-19, what we're seeing in Ramsey County, reminders about the ways we can keep ourselves and others around us healthy, and we're going to do that today. I want to thank Director of Public Health Kathy Hedin for being willing to be a part of today's video and share those thoughts with you. I also want to take this moment to thank Kathy and everyone in the Public Health Department for their work throughout the entire coronavirus emergency period. There were even some articles last week written about the challenge of being a public health official during this time, the types of threats and insults that have been hurled at public health departments and leaders around the country. Throughout this entire time, we've seen our public health department work with community, trying to engage at every level possible with every single person possible. We've seen our leaders provide advice, removed from politics, trying to talk about the best advice that helps keep everybody safe. And through all that, we've been reminded about the disparities that we continue to see that existed before the pandemic, but have been exacerbated during it. And Kathy will talk about all of these different dynamics again with you today. So again, thanks to Director Hedin, thanks to everybody in public health, and thanks to everybody across this organization for their ongoing work. I hope you have a great day.
Hey everyone, I'm Kathy Hedin, the Director of St. Paul Ramsey County Public Health. I hope you are all staying healthy during this pandemic. Here's the current COVID situation update in Minnesota and Ramsey County. In Minnesota, there have been 35,861 people who have tested positive for COVID-19. Last week, 33,227 people had tested positive. Total cases requiring hospitalization to date is 4,031. Hospitalized as of yesterday in the state of Minnesota is 278. Last week, 332. The hospitalizations continue to go down. Hospitalized in ICU as of yesterday is 140 in the state. Last week, we were at 156, also the lowest we've been in a while. Unfortunately, 1,470 people have died from COVID, with 1,129 in long-term care settings. In Ramsey County, we've had 4,689 people who have tested positive for COVID. Last week at this time, we were at 4,389, an increase of 300 positive cases, which continues to slow. Total cumulative cases requiring hospitalization to date in Ramsey County is 682, with 223 who have been in the ICU. Unfortunately, we've lost 217 people to COVID across our county. Last week at this time, we were at 213. Of the 4,689 cases, 29% are white, 26% are Asian, 16% unknown, 16% Black, 10% other, 2% are multiracial, and we now have 22 cases of American Indian people who have tested positive, and 18% of the cases are Hispanic. The cases continue to be a majority in the city of St. Paul, with all cities in Ramsey County having positive cases. Total approximate number of completed tests in the state of Minnesota at this time is 592,955. That's an increase of 79,818 tests over the last week. Remember, you can get this information from our data dashboard by going to www.ramseycounty.us/coronavirus. It's important to keep an eye on what's going on around our nation. Over the past few days, states like Arizona have seen positive COVID numbers as high as 3,500. In Florida and Texas, it's been nearly 6,000 per day, with days where Florida had 9,000 people testing positive. You'll recall seeing the devastation in New York at their peak, where at their highest, they saw 10,000 people a day who were sick with COVID. In comparison, Minnesota is doing well. May 21st was our hardest day, where we saw 981 people who tested positive for COVID. That shows you how well you and other Minnesotans have followed the stay-at-home order. It shows you that you have been doing your part to wear a mask, frequently wash your hands, and stay at home when you're not feeling well. We need to stay vigilant, though. 20 to 50-year-olds in our state have the highest percentages of positive tests, with the 20 to 40-year-old groups being infected with COVID more quickly. We could see our numbers go back up if young people continue to frequent restaurants and bars, hang out in large numbers within 6 feet of one another, and not wear face masks. Younger, healthy people who don't have any underlying health conditions are being hospitalized and are unfortunately dying from this illness. There are things that we can do though. If you hang out with friends, continue to do so in small groups. It's important to stay connected to one another. Wear a mask when you are within 6 feet of people and when you are in public spaces. Continue to wash your hands and pay attention to the symptoms and get tested if you think you're sick. Testing is available all over the state at many different places, both in the community and at your healthcare provider. We've got a long road ahead of us. Only 6 to 10% of our state has been infected with COVID-19. We need 90% of the state to have had the illness or a vaccine that works for the majority of us before we can go back to what we think is normal. We're at least a year to 18 months away from that, but we can beat this if we continue to follow the guidelines. For those of you working in the office, I want to thank all of you for continuing to wear your masks. We finally got masks and you're getting more. Thank you for your patience as our public health department responds to both the needs of the community and the needs to all of us, our staff. You've all done such an amazing job. Thanks for continuing to support us and our community during this pandemic. I hope you have a great week, and we'll see you next week at the Ramsey County Board meeting. Thank you.